The Gauteng Health MEC has reportedly said the province is facing a shortage of condoms because of issues with suppliers. She was responding to a question from the Democratic Alliance where it emerged that there's been a spike in the number of sexually transmitted diseases as a result. The SA Medical Association's chairperson, Dr. Mvuyisi Mzukwa, joins us tonight for more on this. Doctor, very good evening to you. Grateful for your time. So, initial reports said that we were dealing here with a shortage, but I'm looking now at a statement issued by the Gauteng Health Department, not the Gauteng Health Department, excuse me. I'm just trying to get it open on my phone, from the National Health Department, which says there is no shortage, no stockouts, but low levels. But nonetheless, excuse me, how big a risk is this as far as health, sexual reproductive health is concerned?
Good evening to you, Temegile, and to your listeners, and thanks for inviting us to your program. It is a concern, that we have as the South African Medical Association. If we are told that we have low numbers, whatever semantics we are using, to describe the situation, but what we are alerted to is that there is a shortage of condoms in the province of Gauteng. And that is a huge concern for us because we believe that as a country we should not be hospital-centric in our approach to healthcare. We should be looking directly at prevention and making sure that all our prevention tools are in place so that people don't necessarily get sick, but that sickness is prevented. So condoms play a part not only in sickness, but also in family planning. So if you've got low numbers, shortages, whatever terminology you want to use, we are concerned as the South African Medical Association.
So as far as this claim that this shortage or low levels of stock availability is concerned, and the link that's been drawn between that and an increase in the number of sexually transmitted infections in Gauteng, is there an easy link to draw?
There is. Why would we talk about an increase in the number of sexually transmitted infections, and we also at the same time we talk about the shortage of condoms? Because we know that our people are now honestly, if educated, using their condoms properly, and if they don't have access, obviously they are not going to use that. And you know that sexual activity is emotionally driven. You get that 5 minutes hit of the moment, and off you go, and you don't have a condom. So it is important that these condoms are available, at hospitals and also in the malls, wherever people can access them. It can't be that, it will be accessible only to people who are rich, who can buy them from the pharmacies or wherever. It's important for us.
How sympathetic are you then to what the Health Department is saying is an issue that's more to do with approvals by the South African Bureau of Standards, which need to happen because these are imported products and need to be given a stamp of approval before they can be distributed?
I think it will depend on how they manage this context. How do they alert their suppliers that they have a shortage or they have low numbers, as they put it? Because if you are going to wait for the last minute, then you don't expect suppliers to be quick enough. Because remember, the Department of Health, the custodian of healthcare, is not the suppliers. So the Department of Health, should be, ready whenever they should be in a position to monitor, supplies on their depots and stuff like that. Mm-hmm. They can't depend solely on suppliers.
Well, going now into a long weekend, a lot of people will be visiting their lovers and things of that nature. What is the advice for people in Gauteng this weekend? Is abstinence the safest option?
Well, we do preach that and say they must abstain, but we know that it's not easy. So if people can buy alcohol, then they can buy condoms as well. I don't necessarily think that people cannot afford such. They do have to protect themselves. It's important your own health. You don't necessarily have to depend on the supply, from the government side. Even though government should be supplying these things. But if there's a shortage, you have yourself to defend.
Dr. Mvuyisi Mzukwa, good to speak to you as always. Thank you for your time.